Just 11 days until the November elections, and this is not the news Democrats want to hear about a key issue in the campaign, the new health care law.
An Associated Press GFK poll finding 15% of likely voters would leave the law unchanged, while the rest either want it revised or repealed.
Dr. Sreedhar Potarazu isn't surprised. He says Americans are realizing the plan is not good for them financially, but Dr. Oliver Fine says people are just misinformed. How are they misinformed, Dr. Fine?
Well, I think the major thing is, frankly, you didn't point out that 36% of people in that poll wanted the reform to go further than, in fact, it did. And I think what's happening is more and more people are dissatisfied with private health insurance. Let's face it. Premiums are going up for people. The choice is going down because private health insurance limits you to a network of doctors and a network of hospitals. And frankly, people are getting fed up with it. So they want a law that goes further towards what we would call Medicare for all, frankly, a single-payer program.
Dr. Potarazu, do you think that is the direction in which we're moving? And is that the direction we should focus upon or back away from?
I think we need to go further in terms of refining the law to help really cut cost and improve quality. So what Dr. Fine said is that we do need to go further, but we have to go in a separate direction. 37% of the people did say that they want change, but the big issue is that the current law is spending too much money in the wrong direction. And there is no mechanism right now for anyone to hold these insurance companies accountable. And I've said this time and time again on this show, as you well know, that the mechanism of going to a single-payer system or a Medicare for all is not the answer. We have no means of paying what's already been passed right now. We're spending billions of dollars more in terms of what it's going to take to implement this law. And we have to step back for a moment and figure out how to improve those economics.
Dr. Fine, how do you get insurance companies? I know a lot of people do demonize insurance companies, but how do you get them to cover more, like covering kids up until the age of 26 or pre-existing conditions at the same price or even cheaper? I mean, aren't they going? They've been commanded by the federal government to do more. Don't they have to charge more?
Well, what you need to do, it seems to me, is take the inefficiencies out of this system, which is the multiple private insurers, and have a single payer.
Why, though? Don't you think
and
the competition...
that would save, by the way, $400 billion. Do you realize that? The studies have been done that show...
Some studies say it would save. Some studies say that it would make things more inefficient.
Oh.
And Dr. Potarazu might argue with you on that. Go ahead, Doctor.
Absolutely not.
Yeah,
I want to really be very...
That's exactly the point. You're going to spend anywhere from $1 to $10 billion to first insure everybody with pre-existing conditions and under the age of 26. You talk about administrative inefficiencies. We're going to end up spending another $4 billion we haven't accounted for to put in place the exchanges, which adds up to potentially $37 billion. All of this has not been factored into the solvency of the new law. Putting a single-payer system in place, we haven't accounted for the administrative components. I think doctors want insurance companies to come out of the picture.
Okay, Dr. Potarazu.
But what doctors haven't figured out is how to effectively... Yeah.
Go ahead.
Look, we know, for instance, that the Medicare law has an administrative overhead of 3%. If we, in fact, spread that law to all the population, we would be able to save the administrative costs of private insurance, which is anywhere from 20 to 30%. In my office, I would be able to employ fewer people because I need them now to deal with the 25 different insurance companies.
The paperwork.
We did a comparison between Toronto General in Canada with a similarly sized hospital in this country, 3 billers in Toronto General, 300 in this country.
Dr. Oliver Fine.
So one could really save money by going to a single-payer system.
Thank you for leaving the emergency room to come be on the set. We appreciate it.
That is not a prop that he is wearing, by the way. He literally just ran here from the Cornell Hospital
Medical Center. Thank you very much.
Well, thank you for having me.
Thank you, Dr. Potarazu.
Dr. Sreedhar Potarazu.
Thanks for having me on.